There, my name is Cecilia Miller, and I will be doing a presentation of the process of conducting a therapy session. So in this presentation, I'll walk through each stage of the therapy process from start to finish. We'll begin by identifying the client's need for therapy, moving into the intake and assessment phase, as well as discussing how to properly prepare for a session. Then I'll move on to explaining how to open up a session, explore the client's issues, and plan interventions. Lastly, I'll cover implementing the plan, closing up the session, and then ensuring effective follow up and evaluation. First up is identify a need for therapy. So, clients often enter therapy when experiencing emotional distress, trauma, or relational challenges that disrupt daily life. So, that could be family or, friendships or personal relationships with a partner. Um, I would then evaluate readiness and suitability for therapy by using observation, professional judgment, and empathy to build trust. It's important to have, ethical competence, and that ensures the right support is provided, promoting a foundation for successful treatment for the client. Next is intake and assessment. During the intake and assessment phase, I focus on collecting detailed personal, social, and psychological information from my client. I then will go over confidentiality and obtain informed consent to ensure transparency. Also, by establishing rapport with my client, it will help make them feel hopefully respected and comfortable sharing sensitive information with me. Um, and then it's also important to understand their comprehensive background. That along helps provide me accurate assessment, ethical care, and develop a treatment plan that's specific for what they need. And then the next is preparing for therapy. Before beginning therapy, it's important that I review ethical standards and define treatment goals and create an environment that feels safe and supportive for my client. It's also good to reflect on my own competence and potential biases to ensure I'm fully prepared to provide appropriate care for my client. Um, and then I'll be able to choose evidence-based methods that best match what my client needs. An example of an evidence-based method is CBT, which is cognitive behavioral therapy. Um, Basically, that one focuses on identifying and changing negative thoughts and behavior. The next one is opening the session. By opening the session, you want to set a tone for, trust and comfort. So the client comes in and it's just a relaxing environment, no pressure on them, making sure I greet them warmly so they feel comfortable coming in, going over confidentiality again, um, as well as encouraging the client to engage open and honestly, going over kind of what the game plan is for the day as well. Um, and then just being able to build that relationship, establish what's gonna, happen in the session and move on. And so then you set those boundaries between client and myself as a provider. Then it's going to be exploring the client's issues. Um, so during exploration of what the client is having issues with, I will make sure that I'm using active listening as well as empathy with my clients. It's also important that I observe both verbal and nonverbal cues and consider um, cultural or environmental factors that may influence their experiences. Um, and then also through reflection and clarification with the client, um, I will be able to ensure a mutual understanding while also having an insight into what challenges the client is experiencing. Next is goal setting and intervention planning. Um, this is a collaborative process that I use to help empower my clients. I apply the SMART framework, which is specific, measurable, achievable, and um, relevant and time bound to ensure clarity and structure. And then next, I can select interventions based on evidence based models such as CBT and tailor them to each client's strength and needs. This approach promotes accountability and measurable progress with the therapeutic relationship. An intervention example that I have is cognitive restructuring. That is based off. So, if I use CBT as the evidence based model, I then can use cognitive reconstructing, which is basically taking those negative thoughts and then providing positive thoughts towards them to take out the negative thoughts. And then the next one is implementing the plan. And the implementation involves applying the plan intervention while continuously monitoring my clients' progress. I apologize. Um, I evaluate their response, adjust strategies as needed, and maintain clear ethical boundaries throughout the process. By using evidence based practices, I support effective outcomes, ensure my clients receive the highest quality of care. Um, it's also important during all of this to have regular self reflection, and it'll help myself maintain a professional competence in treatment for my clients. Then we have closing the session. This gives my clients a sense of completion and direction. I go through and I summarize everything that we went through the session and then also like their progress that they have been going through, highlighting important insights, and then also giving them next steps for continued growth and things to move on with. It's important by reinforcing their strengths. I help them empower themselves to stay motivated between sessions. Um, I also ensure emotional grounding so that my clients leave feeling supported and, as well as leave feeling good about themselves as well. Lastly, I have follow up and evaluation. Follow up and evaluation help me determine whether clients' goals have been achieved or whether they need adjustments or we need to change goals because things have changed. Just basically a follow-up of kind of seeing where the client's at, what we need to do, what needs to be changed, what's helpful, what's not helpful. um, and then once I'm able to have that feedback from my client and different thing my thoughts into it, This basically just helps them have accountability, being honest with me, what's working, what's not working. And then so that helps them, and as well as it helps me as a provider. So then I know what I could do better for them, moving on or their next appointment. Um, so doing that, I ensure that I remain um in the realm of helping my client with what they need, and also making sure I'm competent in what I'm doing and that everything is still in line with the evidence-based standards for ethical and effective care. Um, and to end that with, I believe therapy works best when built on mutual trust and respect. I aim to make sure I have provide a safe space and a space where a client is able to share what they need to share, no matter how big or small it is. Um, it gives them empowerment, and my space will give them space to learn and grow and feel um strong and be able to start working through the things that they are struggling with or continue to struggle with, or new things that could come up, and help them with growth and healing.